Good afternoon. Myself, Ashu Gupta. I'm heading the Physiotherapy Department at Sports Injury Center, Safdarjung Hospital. The Sports Injury Center came into existence 6 years back, and today, as the demand of sports is increasing, so we have to keep up the latest techniques also. Today, I'm talking about the latest physiotherapy technique which we use in combination of our old techniques, that is called as sports taping techniques. Earlier, our traditional methods, we used to use crepe bandage in all our acute and chronic sports injuries. But the latest technique which is there available with us nowadays is the kinesio taping, we call it as. This taping helps the patient to get back to the sports activity to the earliest. And the main benefit of the taping is that it reduces the chances of reoccurrence. Once an athlete is back to the sports with a sports tape on, then the chances of reoccurrence are very less. And this taping is supposed to be very, very effective in acute sports injuries in joints like ankle, shoulder, elbow, and knee joint. So if it's like a player of football, if he gets an ankle, if he has twisted his ankle, and initially once the swelling is down, after 2-3 days with icing and all, then and if he has to get back, if it's a grade 1 or grade 2 injury, then the athlete can get back to the field with a sports taping, and that taping there is a specific method of applying the tape, and there are very special tapes available in the market. So we apply the tape in a specific manner, and then the athlete can go back to the sports, and the chances of recurrence of injury becomes very less, and he can come back, and then he can resume his other treatment. And the chances of, so that he is not losing his important games, that is the main criteria. Simultaneously, in injuries like problems like tennis elbow, and simple sprain in the knee joint, shoulder joint pain, the athlete or the players, they can have the taping done on them, and then they can get back to the sports. In cricket, fast bowlers, if they have some kind of problem in the shoulder, they can, after an examination and if the injury is not very severe, they can just get the taping done, and they can get back to fast bowling, they can get back to their throwing activities, and with a lot more of confidence. So the idea of the taping is to relieve in terms of pain, and to get the confidence back in the athlete or the sports person. So that way, it is a very, very useful technique which is widely done worldwide as a very important tool in terms of treatment modality of physiotherapy. Thank you.